Okay, so I think we can begin. Welcome to the Minerva Center for Human Rights and our last event of the academic year, which actually is ending, in principle, it's ending today. My name is Broude. I'm a professor at the Hebrew University and also academic director of the Minerva Center for Human Rights. Welcome again to the webinar on Flattening the Conflict, COVID-19 and Peacebuilding in Israel, Palestine, which we're pre-webinar, we were briefly talking about optimism. So it's actually a very optimistic title. And it was coined at a time when it seemed as if the curve of contagion was also being flattened. It was, but now we're facing a second spike. I think this makes the topic even more current. Any implications for the experience of the first curve for the future? I'm really here just to meet. I wish I could meet, but to meet and at least greet, and to say a few words of thanks. First of all, this event is not just by the Minerva Center for Human Rights. It's in particular held under the auspices of the Friedgau Transitional Justice Program, which is a program within the Center for Human Rights, which we've been running for the last 10 years or so, which includes courses, outreach, other activities, and events such as these that are also intended to shift some of the discussion towards peace building and transitional justice. In fact, this very week, we're supposed to have a very large international conference on transitional justice and the crisis of democracy. I think the crisis is still there, but the conference, unfortunately, for obvious reasons, has been postponed. We'll stay tuned. We are not giving up. We'll have that conference perhaps in another format sometime next year. And I'd really just like to thank the Minerva Center staff who's been so involved in, well, it's over the last 2 months. This is our 5th event being held in the format of a webinar, which is not ideal, but still there's a lot to get out of it. So Danny Evron, who's the executive director of the center, Anat Mishali, Dr. O Avigai, who is directs the Transitional Justice Program, and Liana Bernstein, who is in the background here, also on the tech side, and has been doing a lot of the legwork for all these events. Of course, the Friedgau initiative was the main sponsor of the Transitional Justice Program, and in particular, Julie Gal, who I hope is also attending and in the audience. And the Minerva Stiftung, the Minerva Foundation, and the Max Planck Gesellschaft, who have been sponsoring some of our transitional justice activities, and especially the initiator and moderator, the architect of this program, of this event, Dr. Jeremie Bracka, who is a beneficiary as a postdoc, has been for the last year of a postdoctoral grant from the Max Planck and the Minerva Förderung Stiftung. And I think that's basically what I have to say. I'll just introduce Jeremie before he introduces everyone else, because we have a wonderful lineup that Jeremie worked very hard in collecting for this event. So Jeremie, Dr. Jeremie Bracka, is an Australian-Israeli human rights lawyer and lecturer. His PhD is indeed from Monash University. In his PhD work, in his doctoral work, he was conceiving an unofficial Israeli-Palestinian Truth and Empathy Commission. And Jeremie has worked previously at Israel's Ministry of Foreign Affairs, the Israeli High Court of Justice, and the Israeli delegation to the UN, and of course has been a delight to have with us at least for half a year before we had to sort of break up and meet online only in the second semester. So thank you very much, everyone, for joining us. I see we really have a good collection of about 50 participants at the moment. So take it away, Jeremie.
Thank you very much, Tomer, and thank you, Danny Evron, for the opportunity to host this event. It really is a pleasure on behalf of Hebrew University and the Minerva Center for Human Rights to welcome you all to our Zoom event on COVID-19 and peace building in Israel, Palestine. Probably as we speak, everybody's looking and following Zoom events on the annexation, but we are going to be perhaps focusing our optimistic gaze a little bit more on the discourse of reconciliation and peace building. But of course, we will also get to the annexation, so don't be fooled. We will also, in the course of the presentations, give you, the participants, an opportunity to ask questions in the Q&A or directly to the panelists. Your comments and questions are only visible to me, the host, and to the panelists. But should you wish to write questions to the panelists while they're speaking, then they might be able to address your specific comments while they're presenting. I'm particularly proud of our panel today because I think it really reflects a very impressive lineup of leading academics and practitioners in this field. We're looking regionally at Israeli-Palestinian peace building, but we're also going to hone in the second half of our Zoom event on East Jerusalem. And we're going to look at both the opportunities and the challenges presented by the new, very stubborn COVID reality for civic peace building. Indeed, for most of us, we are still in somewhat unknown, uncharted territory. We're still bearing witness to an unfolding health emergency, and Corona continues to wreak social, legal, political havoc across the globe, and Israel-Palestine has been no exception. But of course, in Israel, we also endured a constitutional crisis earlier this year, and today, of course, looming threats of annexation. It's certainly true of the region that we do like to be high achievers. But still, to our end, something fairly extraordinary, I think, surfaced during the first wave of COVID-19, at least for a brief period. Instead of more conflict, we saw growing cooperation between Israelis and Palestinians. Rather than unilateral action, institutional and practical coordination deepened. And for those of us engaged in transitional justice and conflict resolution, we could not help but notice this sort of subtle paradigm shift. Whether it was accommodating Palestinian guest workers, creating a joint communication mechanism, or the supply of medical equipment, Israel and the PA seemed to be, at least for a brief time, more engaged in dialogue than in the old familiar political rhetoric. And also, unlike past emergencies and crises in our region, there seemed to be, with Corona, this awareness around our shared proximity and the existence of a common threat. After all, the virus does not discriminate between Bnei Brak or East Jerusalem, neither does it between Tel Aviv or Ramallah. In the words of one Israeli journalist, all of a sudden, Palestinians can sleep in Israel, Arab health workers are garnering praise widely across Jewish Israeli society, and Israelis are experiencing some form of an occupation. Perhaps this crisis will teach us that we are all human beings. So I guess, without further ado, this all begs the question, could a public health emergency enable the two nations to unite against a common enemy? Has collaboration on the virus, at least during the first wave, made any impact on Israeli-Palestinian reconciliation and peace building? Might COVID-19 be the unwitting game changer, or really is it just business as usual? We, of course, must also consider today, with annexation on the table, has this new discourse diminished any of the earlier gains made by Israeli-Palestinian cooperation? Now, at a theoretical level, and this is where I'll bring in our learned scholar on our Zoom residence, Professor Eran Halperin. Theoretically, at least, many scholars have talked and researched the capacity of cooperation between rivals to reconfigure the psychological dynamics of conflict. The relationship between an external common threat and peace building is an open question, but to help us gain a theoretical footing specifically in relation to a health pandemic and intergroup conflict, it is my pleasure to introduce formally Professor Eran Halperin. He's a professor in the psychology department at Hebrew University. His research uses psychological methods and political theories to investigate different aspects of intergroup conflict. Professor Halperin is an award-winning researcher of emotional processes and field experiments, widely published, and we are delighted to hear his views on this topic. Professor Halperin, the floor is yours. You have 10 minutes.
Okay, good afternoon, and thank you, Jeremy, for this very kind introduction. Still getting used to this very strange way of, lecturing in conferences from my kitchen at home, but it's definitely an interesting experience. I will say that most of my work is more like an interventionist work. So both in my lab at the Hebrew University and in a court center that I'm leading in the last 3 years, what we do most of the time is to develop psychological based interventions that are aimed at changing the minds and hearts of people that are living in situations of conflicts. Actually, you talked about the annexation. So this morning, we've published a survey, a huge survey among Jews and Palestinians in Israel, showing the vast majority of Israelis is opposing the annexation. We can talk about it maybe later, but that's not the topic of the current conversation. What I want to do in the next 9 minutes is to give you a theoretical, socio-psychological perspective on this question of, let's call it, threat and cooperation in times of crisis. And I will start by the notion that is maybe less common or less known to most people, is that, when people deal with health crisis or with any crisis, they don't deal with it as individuals. I mean, they do deal with it as individuals, but they deal with it as individuals that are part of groups. And part of the strength and part of the coping capabilities that we have as individuals stem from our identification with specific groups. So the idea that under threat, what we have to do is simply to decrease the borders or between the different groups is simply, it's a very, very problematic idea, because people need to belong to groups and they need to identify with groups specifically in times of conflicts, because their identification with groups provide them with coping capabilities to the situation. We know that people that feel more confidence in their identification with their own ethnic, national, or social group cope better with health challenges, both individual and collective. And we know that they cope better almost with any challenge in life. So social identification with groups is important. But at the same time, we should also say, and I think that Jeremie already implied towards this direction, that when you look at the literature in conflict, in social psychology and conflict resolution, in many, many ways, you can say that these kind of crises create, at least potentially, an amazing platform for bringing groups together. And I'll try, I don't have too much time, but in 2 or 3 minutes, I'll try to mention 4 or 5 different parameters that can help us think about these kind of situations as situations that can potentially bring people from different groups together. The first thing, and again, we don't like to talk about it too much when we deal with conflict resolution, but think about this notion of a common enemy. Right? Usually our enemy is the outgroup in situations of conflict. In this kind of crisis, we all have the same enemy. You said before, Jeremie, the pandemic doesn't really distinguish between people in Bnei Brak or in Ramallah or East Jerusalem. And you're absolutely right. Everyone has the same enemy, and the enemy is the pandemic. And we have to work together jointly in order to cope with this situation. The second point, which is even more important in this regard, is that we are in many, many ways dependent upon each other. This is a critical point. When we think about ways to bring people from different groups that are in situations of long-term conflict together, interdependency is one of the major tools that can help us do it. And in this situation was a prime example of a situation in which we all realized that we will cope together, but we can also fall together. And this was very, very clear. By the way, it was clear when we thought about the tensions or conflicts between Israelis and Palestinians, but it was also very clear when we thought about internal tensions between different groups within the Israeli society. Think, for example, about ultra-Orthodox and secular Jews, or about Palestinians living in Israel and the Jews in Israel. So that's the second point. The third point is that the borders of empathy tend to expand in these situations of crisis. And think about, one of the biggest challenges that we have psychologically in situations of conflicts is to feel empathy towards out-group members, or some people will say towards the suffering of our enemy. And sometimes what we try to do in order to help people do that is to try and train them in taking the perspective of the other, in taking the perspective of the other, in feeling the suffering of the other in different situations. These kind of situations, like this health crisis that we've been experiencing in the last months, is a situation in which you don't have to make any effort in order to take the perspective of the other. We're already there, because the other suffers in the exact same way as I suffer in this situation. And therefore, taking the perspective of the other and feeling empathy towards the other is no longer such a huge challenge as it used to be in many other situations. And the last point I want to mention is that the borders, the social borders, the ideological borders, and also the physical borders tend to blur during these kind of situations. We don't feel that the borders exist if the pandemic can jump above these physical or ideological borders. And this creates a totally different psychological mindset that can help us or bridge the gap between people on different sides of the border. Another thing that I will say is that to some extent, and it's hard for us to acknowledge it because we've been part of this conflict for so many years, these kind of crises give us some kind of proportion. Suddenly there's something that is so uncertain, that is so unknown, that can potentially, maybe at this point we know that maybe it's not that such kind of a threat, but at some point we thought maybe we will not survive after this pandemic will end. It gives us some proportion regarding the domestic conflicts that we experience throughout the years. I have 2 more minutes, and in these 2 or 3 more minutes, and in these 2 or 3 more minutes, I want to say something that is maybe will provide a more complex or nuanced view on this situation, something that would also be maybe slightly little less optimistic, because we have to at least acknowledge the fact that during these situations, there is also a dark side that exists. And the dark side, if we want to think about it in a very, very, very basic terms, is the fact that when people are under threat, any kind of threat, the first thing that they will do is to hold on to their very, very, very basic group, to their very, very basic values, and to their very, very basic ideologies. At this point, these are not times for people, usually, to take risks, to be creative, to explore new options or new opportunities. These are times to stick to your own values. I'm not saying it in a normative way. I'm describing what most people do most of the time in these situations. On the top of it, what people tend to do in this situation is to search for someone to blame. And this someone, in most cases, will not be part of their group. And we see that in times of financial crises, in times of health crises, when we look at the long-term effects of these situations, so in most cases, intergroup attitudes, emotions, and even motivations tend to polarize, tend to radicalize, tend to become more negative. I'm saying it just in order for us not to get the impression that, and I know that most of this panel would be optimistic because many positive things happened during this crisis, but we shouldn't tell ourselves or say to ourselves, that this is the default situation. And if we will not do anything, if we'll just sit and wait, the cooperation between societies that happened during this crisis would proceed and would create a better and hopeful future for all of us. We shouldn't rely on this situation. We must find ways to frame the way that we coped during this crisis in a way that would create more hope to the future. Because if we will not do that, then the automatic psychological processes that lead usually to an increase in racism and in hatred following these kind of crises would probably operate, and the picture would be much more complicated than what I tried to describe at the beginning of my talk. Thank you.
Thank you very much, Professor Halperin. I think that that's a probably excellent segue in terms of not resting on our laurels. There really is one NGO that I could think of that has constantly shone a light during the long shadow that's often cast by conflict identity and conflict narrative. And of course, I'm thinking in the environmental sector of the NGO Echo Peace Middle East, which has been a pioneer in peace building and cross-border cooperation for more than 2 decades. And their Israeli, Palestinian, Jordanian partnerships on water and other climate issues has been really quite impressive. What I think is really interesting is that today this NGO is setting best practice standards for environmentalists and health professionals in preparing for pandemics. One would have thought, given COVID-19, that the concept of shared destiny, interdependence and regional identity, exactly along the lines that Professor Halperin just mentioned, seem more relevant during a health crisis than ever. So on that note, we actually have with us, to start off, Nada Majdalani, who's the Palestinian Director of Echo Peace Middle East. And it's my great honor to have her here on our panel. She holds a Master's of Science in Environmental Assessment and Management from Oxford Brookes University. Nada has served in capacity building and policy advisory positions in infrastructure, development, water, sanitation. She's also an advocate and participated in several Palestinian-Israeli dialogue initiatives, including the One Voice movement and the Palestinian-Israeli Young Entrepreneurs Forum. Nada's recently addressed Echo Peace vision at the UN Security Council and at NATO, and it seems that in some ways COVID-19 paradoxically kind of gave Echo Peace some wind in their sails and more relevance. So without further ado, I'd like to give Nada the floor. Nada will need to unfortunately jump onto another Zoom call. So I do ask you all participants, if you have a question for Nada, now's the time to ask. You're welcome to write to her also in your chat to her, and she will be the only person that could see your question. Otherwise, you can ask the question in Q&A. So Nada, the floor is yours.
Thank you, Jeremie, so much, and thank you for hosting. Iran, I've really enjoyed your input here. It gives a lot of perspective, and it gives a lot of fruit of thought and food for thought, because it really indeed shells and gives a shell to what we are actually doing in practice and in our day-to-day life. We are so absorbed as Echo Peace at looking at the practitioner side, but not at the philosophical side of issues. But this was really fantastic. So for those who are unaware of Echo Peace Middle East, we are a regional, unique organization. We are operating out of offices in Ramallah, Tel Aviv, and Amman. And we, for the past 25 years, have been heavily engaged in environmental cross-border cooperation and influencing policy change in issues relevant to shared environmental and water resources. Our strategy is based on community engagement and the bottom-up approach of working together with our communities, with our youth, women and farmers and municipalities and community representatives, but also coupled with a lot of advocacy on the top-down approach with our decision makers, each from their own perspective or respective office and country. With the issue of COVID-19 and peace-building perspectives, we've been really watching closely, like everyone else. We have worked together remotely over these past few months, updating each other on the latest developments in each of our countries, how things are developing on the ground, and how they're affecting our activities and our engagement with the communities in terms of our education, in terms of our youth engagement, and in terms of our also attempts to advance on projects, particularly in the Jordan Valley, in terms of economic development, etc., etc. The past period has definitely been very difficult in terms of watching the escalating numbers of the COVID-19 cases. We're, as you've mentioned before, seeing a second spike in terms of numbers, at least here in Palestine. In the past week, we're starting to see 100+ cases each and every day in terms of increased numbers. We are particularly concerned that our health systems here in the West Bank, but particularly in Gaza, will not be able to cope with the situation in terms of the ability to hold large numbers of cases that would require medical attention and ventilators. This gives me to our specific topic and interest as EcoPeace, which is access to water and sanitation equitably and equally for all the people in the region here in Palestine, Israel, and Jordan. And when we look at the pandemic and the number, one shield and protection to avoid catching the disease is basically to wash your hands, to sanitize, to clean up, to wash whatever you have brought from the supermarket, etc., etc. And when we put into perspective that this is actually going from March until now, the peak of the summer, where actually our region entirely is affected by shortages of water, of natural water, precisely, and with the discrepancies in water, access to water and sanitation in terms of quantity and quality, we here are facing a real threat in terms of the inability to contain the disease in terms of the ABCs of its containment, which is basically appropriate washing and sanitation. For the Palestinian communities in many areas, we are, and especially now at the peak of the summer, in some communities we have shortages of water that would reach up to 28 liters per capita per day, which is way less than the recommendations of the World Health Organization. And basically, as Iran has mentioned, we are very much interdependent. We have seen over the past few months some sort of cooperation in terms of exchange of information about the pandemic, arrangements for workers, for Palestinian workers coming back and forth from and to Israel. We have seen several arrangements in terms of also the entry of medical equipment and material and tests to Gaza Strip. But this shows exactly that our societies are very much connected, and we are all in the same boat, similar to any other climate crisis or natural crisis or disasters. This gives us if we stop for a minute and we look at the larger perspective, the COVID-19 pandemic is just a small wave, which is which can be then related to a larger wave, which is climate change. And this is very much what also EcoPeace is addressing in terms of a shared concern for the entire region. And when we compare both climate change and the COVID-19, we are speaking about the necessity of all stakeholders in the region cooperating in terms of academia, policy policy briefs, research, policy changes that would basically enable cooperation on all sides to curb the impacts of these crises. And this is what exactly EcoPeace is trying to do. We have published in a couple of months ago a report which addresses COVID-19 and its presence in wastewater, regardless whether it's treated or untreated. We have brought in evidence from research in Europe, in the US, and other parts of the world about the presence of traces of the COVID-19 virus in wastewater. And we have highlighted the fragile infrastructure, particularly in Jordan and Palestine, to cope with treating sewage up to a level that would eliminate any spread out of the disease. We have provided a lot of policy recommendations as well as technical recommendations to our 3 governments in terms of dealing with wastewater, and particularly transboundary wastewater streams, which we also have between Palestine and Israel, where also require a lot of attention from both sides, but as well as from the international community, community support that is required to address this problem and work together on the treatment of the sewage and development of these infrastructures. The entire situation at the moment, as much as we see it dire, and I understand that we need to be optimistic up on this panel, I at least feel like EcoPeace resembles indeed in its day-to-day operations an example and a model for cooperation and coexistence. We are trying to pull threads together which are impossible. We are trying to work against the waves, and I have a quite contrary opinion to what Ran said, that sometimes in times of crisis we need to cling to our own tribes and to not take risks and not be creative. On the contrary, I see EcoPeace on a day-to-day course, taking unexpected, steps and creativity, and literally we're all the time trying to think out of the box, and even crossing some taboos in terms of bringing Palestinian youth to speak together with Israeli youth and Jordanian youth to discuss issues. I'm done.
But I actually would, if you don't mind, I want to draw you in, because you have to leave, specifically on that last comment about taboos. And because you are the Palestinian co-director of an Israeli-Palestinian Jordanian NGO, you obviously have to deal with some challenges that obviously Gidon, for example, wouldn't have to deal with. And I wondered whether you could just speak a little bit about some of the challenges that you face in peace building and cooperation with Israelis as your counterparts as a Palestinian. That's the first point. But the second one is whether you could specifically talk a little bit also to whether you think COVID, this particular health crisis, as opposed to, say, climate change, which is far more global, do you think that COVID has given a bit more legitimacy or credibility to the work that you specifically do at EcoPeace, given the environmental regional focus?
Okay, to answer your first question, absolutely. It's not as pinky and rosy and all, fluffy teddy bears that we are facing here. We are definitely working against difficult currents, particularly in this current situation. We are facing today one of the perhaps highest political or politically difficult situations with annexation, etc. On the ground, we are in normal cases accused of being normalizers and traitors and working with the enemy. But I think we've got a leverage point where when we address issues related to particularly water, environment, sanitation, basic services to the people, trying to also build the capacities in issues that are relevant to innovation and economic prosperity. On the national Palestinian side, we are starting to engage more with our communities and make them understand that we are not actually working against the currents. We are actually in line with the mainstream political aspirations for a two-state solution and an independent Palestinian state living side by side with Israel in peace and prosperity on the borders of 1967 borders. We try to explain that we are working within these parameters, and whatever we're trying to do is basically to establish and to work with our communities on the bases and platforms that should peace come across us, hopefully in our lifetimes, that that our younger generations and ourselves are ready to take up this peace and move it forward and prosper together. This is where we try to leverage on these kinds of discussions, because we try to highlight the self-interests of Palestinians in their independence, in their ability for self-determination, in their ability to access natural resources, especially water, and obtaining their water rights. All these issues, they touch deeply the minds and the souls of the Palestinians, and we start to see some leverage points there. In terms of COVID-19 and climate change, I kind of forgot your question.
The question was that climate change tends to be something that is more easily dismissed or understood as a global response that individuals don't feel as closely or intimately. COVID-19 literally saw people kind of imprisoned in their own homes. So, yeah. And also had a much greater sensitivity and awareness of, if COVID-19 were to become a disaster in Gaza or in the West Bank, that would directly affect the lives of Israelis. There's a self-interest, I think, that COVID-19 presented that climate change in the same way does not. So the question is, did COVID-19, because of its immediacy and its direct impact, give more legitimacy to your work at EcoPeace?
So let me add here that the way that we've divided our talk is I'm going to speak mostly on climate change issues. There, Jeremie.
So I'll leave it to you, Gidon, because I need to leave.
So we'll let me leave. Well, thank you very much, and we will now introduce Gidon. Thank you.
Thank you so much. And for any questions, I don't see any questions here, but for any questions, whoever would like to ask, my email is nada@ecopeaceme.org. Thank you so much for hosting. Bye-bye.
Thank you very much. So I'm now particularly thrilled, of course, if any NGO during a non-health emergency would need creativity and vision, then clearly one during a health crisis would need even more of it. And I think that that is a good introduction to Gidon Bromberg, who I'm thrilled to also say is a fellow Australian and also an alumni of Monash University. Gidon is a lawyer by profession, but thankfully not by practice, because he is the co-founder of and 25-year Israeli co-director of EcoPeace Middle East. And I think he is a visionary. He's an expert on the relationship between water issues and Middle East peace, and has presented before the UN Climate Summit, US Congress, European Parliament, and other international forums. So I look forward to him continuing the discussion and taking up the question about specifically how Corona has impacted the work of NGO EcoPeace Middle East.
Thank you very much, Jeremie. It's wonderful to participate here in the panel. and really to build on many of the comments that both Nada just made, but also of the more philosophical background that also Iran spoke to. I think we can really speak for about 25 years of practitioner experience of what peacebuilding is about. We can really draw from some of the lessons of COVID to try to further advance, not by accident, as sort of Iran alluded to, but really by design. That peacebuilding, conflict resolution, doesn't happen willy-nilly. It's only going to happen if we put our minds and efforts and we design strategies that help advance conflict resolution. So Corona, as was said earlier, is an issue of common concern. It doesn't respect borders, and it requires cooperation to deal with the pandemic. Well, so many of the environmental issues that we face in the region are likewise issues of common concern. Water scarcity issues that Nada just mentioned, environmental pollution, be it water, air, biodiversity loss, similarly don't respect borders, and of course, the overarching issue of climate change has no respect of borders whatsoever, and its implications on water security, as one example, but also food security, has truly transboundary implications. So one of the first issues that at EcoPeace we're trying to promote an understanding of what we can draw from COVID to further advance the type of work by design that we do is first and foremost that COVID shows us that we pay a heavy price as a community if we ignore science. So we've seen some reckless leadership around the world, United States, Brazil, in the initial period, United Kingdom, where the coronavirus wasn't taken seriously. And the science behind Corona wasn't taken seriously, and the population paid the price. More than that, we also saw populist politics in place. Populist politics that was ignoring the science, belittling the science in a manner to somehow draw conclusions that there's no real threat here. Now, we see parallels. We see parallels taking place in the blame game of a surge intifada. We've had Israeli politicians come at various times and to say that Palestinians are sending their raw sewage to Israel. It's another type of intifada, which is pretty much ignoring the facts on the ground. It's very populist. It's ignoring the science. There's a dual responsibility here, yet populist politicians have succeeded to advance that narrative. Also on the Palestinian side, we've seen narratives where the water crisis, water scarcity facing Palestinians is wholly and solely due to water theft, that Israel takes all of the waters that would otherwise be available for Palestinians. Again, ignoring the science, ignoring facts on the ground, that there is a dual responsibility, including failure on the Palestinian side to manage water resources, in addition, of course, to not having a fair share of the natural water resources available. So, in the environment side, we've seen a lot of populist rhetoric help defeat the ability to try to bring the parties together to solve these problems at the demise of both communities. So, when raw sewage crosses from one side to the other, it pollutes the scarce water resources of both populations. It leads to a public health crisis, potentially on both sides. And we see that strongest in Gaza, where the water and sanitation crisis in Gaza, in fact, led to 97% of the water resources of Gaza no longer being potable. But thankfully, we saw a response that to the Gaza water and sanitation crisis that became much more adult, that became much more responsible, and particularly, and Equipeace, in fact, released the information after the desalination plant in Ashkelon, just north of Gaza, started to intermittently close down because the raw sewage flowing out of Gaza was being flowing into the Mediterranean and being carried up the coastline to Israel, polluting Gaza's beaches, but also polluting Israel's beaches, and closing down intermittently 15% of what is today's Israel's drinking water source through the desalination plant of Ashkelon. And just the release of that information, that the crisis of Gaza becomes a water security issue of Israel and a national security issue for Israel, leads to a change in policies. We saw that taking place even before COVID. With COVID, we saw tremendous fear, tremendous concern that a COVID crisis in Gaza would indeed have very dire implications, not only in Gaza, but of course in Israel, with potentially hundreds of thousands of Palestinians in Gaza walking towards the fences with Israel in fear of staying in Gaza as a potentially infected enclave. In the broader picture, we also, of course, see that in climate change and you know the upheavals in Syria with water scarcity related to climate change being one of the root causes, not the sole, but certainly one of the root causes for the Syrian uprising that leads to millions of Syrians having to leave their homes and some 2 million refugees walking into Jordan, further implicating Jordan with even a deeper water crisis. So Amman, before the Syrian uprising, before the refugees move across the border, water in Amman is supplied intermittently, only 2 days a week. Presently, with climate change and Syrian refugee crisis impacting Jordan, water supply in Amman is cut from 2 days a week to only 8 hours a week, which very much threatens Jordan's national security. And Israel increasingly understands that any threat to Jordan's national security, of course, is a threat to Israel's national security because of the importance of that Israel-Jordan peace treaty. So what we've seen, what we see in the shared environment crisis, be it water scarcity, be it pollution, be it climate change, is that there is a greater realization of interdependencies. And COVID helps us to bring that message home. COVID helps us to highlight the populist policies that are not based on science, that are not based on facts, that will lead to disaster, as COVID has led to disaster by those states that chose to ignore the science, that those leaders that hopefully then will pay a price by their public next time they come to elections. So at Equipeace, we very much see the COVID crisis as an opportunity to utilize COVID for a wake-up calls, as a wake-up call. We also see that even Member of Knesset Bennett came out with a statement yesterday that given the second wave of COVID being present, Bennett, of all of the political leaders in Israel, calls on the government of Israel to ignore everything else and just focus on the pandemic in Israel. And although he doesn't say, stop stop moving forward on annexation, he very clearly says, stop everything. And for a politician of Bennett's political leaning to come and say days before annexation is supposed to take place that the government should stop everything and just focus on the pandemic is very interesting. I think something that we can learn from, that perhaps even politicians that would arguably be generally very populist in their approach are taking lesson from perhaps the misguided populism of politicians that we've witnessed in other parts of the world. So I leave it there, and I look forward to further comments and questions from the audience.
Thank you, Gidon. We're now going to move to the second half of our Zoom event and hone in on East Jerusalem, where the COVID response also was notable, in that Israeli authorities seem to directly engage with the Palestinian community, otherwise excluded from the national conversation. And what we saw was an institutional drive by the Israeli Health Ministry, the Jerusalem municipality, and Magen David Adom to contain the pandemic. Of course, this wasn't without its problems and it wasn't seamless, but it did seem to be the case that, again, Israelis and Palestinians worked together. Civil society also had a role to play in dealing with food shortages, testing, medical training, and many other aspects of the crisis. Writing on this specifically and other Jerusalem-related matters, we are honoured to have on our panel Nir Hasson, the Haaretz correspondent on Jerusalem and archaeology. Nir is an expert on Jerusalem. He's been covering it for Haaretz since 2008. His varied journalistic career also includes 2 years as the deputy news editor of Haaretz. His first book, Urshalayim, Israelis and Palestinians in Jerusalem, examines the relationship between the two peoples who share the city. So I can't think of a better person, better placed to talk about these issues. And I will now give the floor to Nir to talk to us about an article that he wrote specifically about this, his views more widely on East Jerusalem during COVID-19, game changer, business as usual. Nir, the floor is yours.
Hi, Jeremie. Hi, everyone. Thank you. So in the next 10 minutes, I will try to have a look on the East Jerusalem case as a test case for the relationship between the Israeli authority and the Palestinians during the coronavirus crisis. And first, we have to say that at the beginning of the pandemic, we had many reasons to be afraid of what is going to happen in East Jerusalem. East Jerusalem have some characters, some aspects that made the disease pretty scary, pretty dangerous. The fact that many of the families live in a multi-generational, like the grandfather and the grandmother lives with the father and the mother and the kids, and they're all together. They live in very crowded conditions, and of course they don't. The Palestinians, I think, don't have a natural social social distance like on the daily life. They shake hands a lot, they hug and kiss a lot, and of course the situation of the health system in East Jerusalem is pretty bad. So we have the whole reason to be very worried about what's going to happen. Now, until today, we have to say that the catastrophe didn't happen. We have about 250 people who got infected in East Jerusalem, which is pretty low compared to the other Jerusalemite communities like the Ultra-Orthodox or Jews in Jerusalem altogether. And the reason why the level of disease in East Jerusalem is so low, no one actually knows the answer. There are few explanations, well, the common explanation is that the Palestinians in East Jerusalem were not part of the first circles of infection in Israel. The first circles of infection in Israel were people who came back from abroad and people who took part in Purim celebrations. And the Palestinians weren't in those two groups, and so they didn't get infected at the beginning. And later on, they took very seriously the instructions from the Ministry of Health, and they succeeded to avoid the spreading of the disease in East Jerusalem. And what we saw, as my editor in Haaretz called it, honeymoon period in the relationship between the Israeli Authority, especially the Jerusalem municipality, and the Ministry of Health, and the Palestinian population of East Jerusalem. And as Eran says before, I think that what helped those days of working together is that the coronavirus, the Palestinians saw the coronavirus, they didn't saw it as a Zionist plot. They really saw it as a common enemy, on the one hand. On the other hand, they really afraid of it. On the first days, the first weeks of the pandemic in East Jerusalem, people really spoke about it's going to be disaster. It's really scary. We have to take care of for our elders, and I think the combination between the understanding that the corona it's not part of the occupation on the one hand, and the corona is really scary, so we are willing to accept every help that we can get. A friend of mine, a Palestinian worker he worked in a clinic in East Jerusalem, actually complained that the Shin Bet didn't do the pandemic research in East Jerusalem. I think it's the first time since '67 that Palestinians actually complained that the Shin Bet is not doing enough in his community. So they really had they really want to get help from whatever it comes. If it's from the IDF, it's fine. If it's from the Shin Bet, it's fine. We need everyone. This is from the Palestinian side. On the Israeli side, I think that the Israeli Authority and the Jerusalem municipality, in particular, find out that they have someone to count on in East Jerusalem. Traditionally, organization, NGOs, leadership in East Jerusalem considered to be in the Israeli eyes as a threat. We have to diseliminate and to arrest the heads of the organizations, and it must be connected to the PA somewhere. And I saw in the coronavirus that some parts, not all, some parts of the Israeli authorities started to see the NGOs in East Jerusalem, the civil society organization in East Jerusalem, as a benefit, as something that we can work with, that a factor that can that have a good effect on the field on East Jerusalem, and this was new. Thank you. So this is the honeymoon, and we had some symbolic gestures The most remembered one is the Israeli Air Force flew over the hospitals during the Independence Day, and the mayor Moshe Leon asked them to do a round above the St. Joseph Hospital in Sheikh Jarrah in East Jerusalem, which it's pretty weird, yes. An Israeli Air Force flew over as a gesture over a Palestinian hospital, but as much as I know, the Palestinians got it like, okay, it's fun. It's like it's a fine gesture. But I want to add something that is maybe less optimistic. In the last decade or so, we saw that Israel put some more money, some more budgets, more attention to East Jerusalem. They built more infrastructure, more roads, more schools, and we saw it in the Corona as well. Like the Ministry of Health, even the IDF and the municipality put more attention to East Jerusalem. But my point is that we have to notice between soft currency that Israel paid for East Jerusalem and hard currency. What I mean is that soft currency is money. Money is not a problem. You can put money, you can put small amount of money for buying food for the neighborhoods, or you can put a lot of money to build schools, but money is not a problem. I think that the Israelis and the Israeli leadership do not deal like they prefer to put the money, to put the budget, because they don't want to deal with the real problems, the real rot case problems of East Jerusalem. And I think we have three main structural problems in East Jerusalem that we have to deal with. And until the authority will not do steps in those three fields, it doesn't solve anything. And what I mean is, first of all, is the neighborhoods behind the fence. We have to remember that about a third of the population of East Jerusalem, more than 100,000 people, live in territories, in neighborhoods beyond the separation wall, with a very low level of services and very bad conditions, life conditions. And the second thing is the issue of housing and construction and planning. And this is not an issue that you can solve by money. You can only solve it by paying price of space, of place, because you have to redesign and reshape the neighborhoods, the Palestinian neighborhoods of East Jerusalem. Actually, the boundaries of the Palestinian neighborhood of East Jerusalem today are the same boundaries from '67. And this is, of course, you cannot heal the city, you cannot solve the problem without dealing with that issue. And the basic DNA of the Israeli authority is we are not giving the Palestinians one more inch, because it's opposite to our Zionist beliefs or whatever DNA. And the third and most problematic problem is, of course, the legal status of the Palestinians of East Jerusalem. That we have in Jerusalem two kinds of population. Okay, we have the citizens like me and like the rest of the Jews in Jerusalem, and we have the residents, the Palestinian residents that don't have the full rights. And this is actually a situation that affect everything, affect the daily life and the future and the relationship between Israelis and Palestinians in Jerusalem. And as long as I see it, of course, as long as the Israeli leadership do not deal with those issues, the cooperation with the NGOs and the deliveries of food trucks or the symbolic flyover hospitals will not solve the real problem of Jerusalem. So the point is that maybe the pandemic made some kind of honeymoon in Jerusalem, but we cannot trust on it. I mean, at the end of the day, we have to deal with the real problems, with the real issues of Jerusalem. So yeah, this is my short talk about the issue. Jeremie.
Thank you. Okay, we have a little technical issue, but I think we have Naveen on board, who is our final speaker. Naveen, is your video able to work? Can you hear us? Here we are. Okay. So Naveen Sanduka is in some ways the counterpart to Nir on the specific topic of East Jerusalem. She's an expert in East Jerusalem in the field of program development, management, peace building, and gender issues. Currently, she works with the German Association for Development Cooperation, but she's also the executive director of a newly established NGO called Our Rights, or Kukna, in Jerusalem, focusing on civil and political rights of Palestinians in East Jerusalem, especially women. Previously, Naveen was the co-director of IPCRI, Israel-Palestine Creative Regional Initiatives. She currently sits on the board for the Jerusalem Center for Women Alliance and Middle East Peace, ORMEP. And I very much look forward to hearing her respond to Nir's perspective and gaining, if you like, a bit of dialogue on the role of East Jerusalem during Corona. Is the honeymoon over? Was there ever a honeymoon? The floor is yours, Naveen. You have 10 minutes.
Cool. Jeremie, I think can you hear me? Because it tells me that I'm muted. Okay, perfect.
We can hear you.
Thank you. So good evening, everybody. Thank you so much for hosting me today. And thank you for the wonderful speakers, very insightful as usual. And for the participants who are listening to us here as well. So is the honeymoon over? I don't even think there was a honeymoon. I think we started getting to know each other, kind of dating process. I would call it like that. So I will take it from there. And well, the COVID-19 crisis in general has triggered both parties, the Palestinians and the Israelis, to start thinking outside of the box, to start thinking of new innovative ways, especially as my esteemed colleagues has mentioned, that basically viruses and epidemics in general, they don't know borders and they don't really differentiate between ethnicity or gender. So that said, I think that we should, first of all, specifically in East Jerusalem, try to analyze what is the context that we are dealing with to begin with. So first of all, the realities. One reality is that Palestinians in East Jerusalem, they have a lack of representation in the formal bodies. What I mean by that is that we don't have representation in the municipality of Jerusalem. And I doubt that we have a voice in the Ministry of Health, Israeli Ministry of Health. We do have, however, a Palestinian governor and a Palestinian also municipality that is supposed to be part of the Palestinian Authority. But to what extent are everyday and average Palestinian feel represented by those? That's a big question, and I don't think they are represented actually, or the other side, it's not also representative as well. The other reality that we need to take to look at is the separation wall. We still have communities that are considered to be part of East Jerusalem, but they are behind the separation wall, or they are closer to the Palestinian Authority, including towns like Kufr Aqab, Anata, and Shafat refugee camp, and others as well. and those are densely populated. The municipality of Jerusalem does not provide them with the proper services that they need. There is a lack of security over there, and also the Palestinian Authority usually doesn't intervene over there. So it's kind of a lawless land. The third reality is the reality of normalization. So when a Palestinian entity in East Jerusalem wants to create a bridge or wants to work with initiatives from the Western side, especially in terms of civil society, they are viewed as the normalizers. They are viewed as the traitors. If you want to have a representation in the municipality of Jerusalem, there we have seen a couple of voices of people want to be represented in the municipality of Jerusalem. They were viewed as normalizers, and they were threatened if they don't withdraw. And the last reality is the reality of the police violence and the lack of trust between two sides. I mean, police violence has been there from the Israeli side towards the Palestinians forever, almost. The last case we saw was Iyad al-Hallaq, the autistic kid, the autistic young man who was murdered in East Jerusalem. So these are the realities that exist. And then we are hit hard by the COVID-19. And that, Nir, I would like to say, first of all, that Palestinians actually were very skeptical about it. You could hear lots of conversations going on that this is actually a conspiracy. And it's a conspiracy because Israeli government wants us to stay home, because they want to take control of Al-Aqsa Mosque, because they want to continue, you know, with the digging over under Al-Aqsa. You could hear that all over, that this is a conspiracy, it's not happening, and we shouldn't be staying at home, and we should be alert. The other thing came from religion and religious leaders, not leaders, but more or less the people who are more religious. And they were saying this is an epidemic that will not harm Muslims, because we don't eat pork and we don't drink wine, and we have, you know, we're very clean, and we pray 5 times a day, and so we have to almost take a shower 5 times a day. So this epidemic is not going to harm us as Muslims. And the other thing I would also like to emphasize on your point, Nir, you mentioned, is that yes, true, we live in a very condensed houses where we sometimes live with our parents or grandparents. We have very close social ties. So when we finally realized that this is actually an epidemic and this is actually happening, that's when we started fearing for the lives of our elderly. So we kind of like really, so a lot of people stayed home, you know, sanitizers, less and less visiting of the family members and things like that. Now, in terms of a response, because of the political reality that existed in East Jerusalem, we saw 81 civil society organizations and a couple of very well-known people in East Jerusalem, together with a few international organizations and the help and support of the World Health Organization. The Jerusalem Coalition was formed. And it was formed because there is a lack of leadership in East Jerusalem, and there is this mistrust and miscommunication with the Jerusalem municipality. So this coalition was formed, and they basically did 3 main things. First of all, they equipped the hospitals in East Jerusalem, St. Joseph, to be a quarantine center. That happened without the support of the Israeli Ministry of Health. It happened as a Palestinian initiative, civil society initiative. We looked at them also preparing quarantine, hotels for quarantine in East Jerusalem as well, which did not have any sort of cooperation with the Israeli side either. And they also used social media a lot to put in information and raise awareness in Arabic, in a language that the people are going to understand, using people who are influential in East Jerusalem to talk about the epidemic and to talk about what we need to do. And I think that was very much needed. And the people were engaged with them because those were talking our language, and there's trust. And basically, we know that this is a community unity. that is happening in East Jerusalem. Unfortunately, in the beginning, we saw that the Israeli police were not really very cooperative with the coalition. What happened is that some of these people, as they were disinfecting mosques and disinfecting other organizations, were actually taken into detention and not detention, they were put in prison and then like later on house arrest. When I spoke personally with some people of the coalition, they said, no, we don't want to cooperate with the municipality because this is considered normalization. You talk to the municipality, no, we don't want to talk to them. So it's kind of like that was a dead end. It's much needed cooperation, but it's not happening. So what was happening is that also due to this, it kind of put pressure in the Jerusalem municipality specifically, but also from Israeli civil society organizations who put also pressure on the Jerusalem municipality to finally take action, to finally step up. So yes, we are going to be optimistic and say steps were taken, but they were taken too small, too later, yani too little, too late kind of thing. So we're talking about testing centers for 350,000 people across. We only had 3 testing centers for East Jerusalem. What about the communities behind the separation wall, like Kufur Aqab, Anata, and Shafat refugee camp, where it is mostly densely populated? And finally, when we saw cases of coronavirus in Kufur Aqab, the Palestinian Authority actually found out the cases. It wasn't cases that were identified by Israel, it was cases identified by the Palestinian Authority. And finally, Israeli intervened, but they intervened by the army to enforce people to stay in their houses and to enforce a lockdown. And as a political act, they took away all the signs that showed any kind of power for the Palestinian Authority in that neighborhood. Now, to look more specifically also at the ministry, Israeli Ministry of Health, first of all, let us say the awareness brochures and things that were coming up on social media were basically in Hebrew at the beginning. And most of the people in East Jerusalem don't even know Hebrew. But later on, more or less, there were some Arabic coverage, which was okay. I'll come now to the positive things. Jeremie, if you give me more than 1 minute, I will really appreciate it. Thank you. Thank you. So basically, and this is when the dating started. The dating started when the municipality of Jerusalem found out that they don't know the language, not Arabic language, but they don't know how to communicate with people. They, not only with the Palestinians in East Jerusalem, but also with the Haredi community. They don't know how to get close to the people. They don't know the needs of the people. They don't know how to talk to them and represent them. Finally, when they understood that, they were supporting through other means, other civil society organizations, that, initiatives that were happening. So in East Jerusalem, it's true that as Dr. Iran pointed out, that we come together and we close into our own groups and become more more close to each other. But in that sense, there are some people like me, like others, who also thought, and this is the opportunity to start cooperating with each other. So we saw, for example, some activists from what is called the Jerusalem model, who took grants from the Jerusalem model. Usually, I assume it is American philanthropists who gave them financial support to distribute food parcels and to also work with the kids, you know, in the neighborhoods to kind of like get them outside of the social isolation. So this was happening. And strange enough, they got permits from the Jerusalem municipality, unlike the coalition that was formed in the beginning that didn't have permits. These people had permits to work and cooperate and to distribute the food parcels. We're talking also about a political party in Jerusalem, Itarerut, Sahwa. So waking up, I think it's called. I cannot pronounce it in Hebrew very well. But they also, Itarerut, were doing something in West Jerusalem, and they also wanted to do the same in East Jerusalem. So they recruited Palestinian volunteers from East Jerusalem. They were able to get funding from Jewish donors, distribute as well food parcels to the people. In the Jerusalem municipality as well, there were also some very good people in the municipal council who saw the need to communicate and to try to get more information on what is happening in East Jerusalem as well, to enroll them in the welfare system. Now, this is again where politics comes in. There are so many needy families in East Jerusalem, but they don't want to enter any system because they're afraid this is going to jeopardize their residency in a way. Collecting information is always something very scary for Palestinians. So by that, I'll stop. And if there are questions, then maybe I can actually answer them.
Thank you very much, Naveen. I think that that offers us a much more complex picture of East Jerusalem. What I'd like to do now, while our participants are free to write questions in the Q&A, continue writing questions to the panelists, is give our panelists an opportunity to respond to one another. I have a few questions I'd like to ask as well, but perhaps we'll do it sort of in the reverse order. I might just ask Nir to come back in if he likes, to respond to Naveen's sort of more nuanced analysis. So we don't have a honeymoon, we don't even have married at first sight, we more have a meet and greet. But Nir wrote an article in May this year that, at least in English, was translated as Dawn of a New Era, Jerusalem and its Palestinian residents joining forces to battle the coronavirus. And then when I spoke with Naveen, I understood that the article was translated in Arabic and had a very different impact. So I just want to give Nir an opportunity to respond a bit. You know, was your article when you first wrote it too optimistic? Or do you still believe that in fact we are perhaps seeing the beginnings of some kind of opportunity to change the discourse or business as usual in East Jerusalem? Nir.
Well, I think it's the case when the editor gives you the headline that takes the article one step further. And I think the headline is a bit more optimistic than the article itself. And I agree with Naveen. I think the situation in East Jerusalem is much more complicated than honeymoon or a new era, or and I think that you spoke a bit about the political level in the municipality. I think we have to mention Moshe Leon as a factor. The new mayor of Jerusalem, Moshe Leon, I think he found out that he can act freely in East Jerusalem. The former mayor, Nir Barkat, was also acting in East Jerusalem. He had all kind of plans and initiatives in East Jerusalem, but he always had to excuse the acts he did in East Jerusalem by saying, well, I'm doing that X or Y, and I invest in new roads or new schools, but I'm doing that because it's important for the Israeli sovereignty in East Jerusalem, or it's important to unify the city, or etc. It always have to come with a political excuse, like it wasn't straightforward, and this is because I think that Nir Barkat was always suspected as a left wing, and they have always had to prove to everyone that no, he's really a nationalist, right wing Likud ideology belief. And Moshe Leon is feel pretty free because nobody suspecting that he came from the left. He have a very right wing ultra orthodox coalitions, and he can actually act in East Jerusalem without those excuses. And I think that he found out that he gets the credit, the credit from the media and from the public of taking care for East Jerusalem. And this is new. This is new for East Jerusalemites, that they have a mayor that actually care about them and can act there pretty free, without the political I don't know
constraints.
Problems that come with it. And as I said before, I think that we have to wait and see how Moshe Leon is going to deal with the most deep problem of East Jerusalem. And I'm not very optimistic about it. I feel that sometimes the symbolic acts and the meetings, and I remind you that he went on visiting the 9-year-old child from Isawiya, Malik Isa, who were shot in the eyes by a sponge bullet by the police, and he went to the hospital and visiting him. It was very, very nice, very kind. But again, at the end of the day, it's a symbolic act, and we have to wait and see what he will do with the real problems of East Jerusalem. And then I don't see much of a change on that field.
Okay, thank you, Nir. I think what we're hearing on the Jerusalem front is that the situation is far more complex, and that when Naveen talks about too little, too late, in some ways you're talking about sort of talk is cheap, and we need more structural, systemic change rather than symbolism. Perhaps we will tease out more of those issues in the last bit of our event. Just a reminder, the Q&A is a function where you can actually write your questions. So for those of you who aren't familiar with it, you go onto the Q&A and you actually write your questions. I'll be able to see them, so will the panelists, and then I can invite the panelists to address your questions specifically. We have a few questions which we'll get to, but before we do that, I'd like to give the floor back to Gidon, the Israeli Echo Peace director, who has also the opportunity to respond in a few minutes to the comments that were made by the other panelists. Gidon?
Thanks, Jeremy. So I very much agree with Nir here and Naveen that the opportunity that COVID presents will be lost if it's not utilized to speak to the political aspirations that are the elephant in the room. That's the same perspective that we take in EcoPeace on the environmental issues as well. That cooperation on the environment side, which has been relatively effective, will only lead to conflict resolution if there's also movement on the political side. So the strength of working on water, which is somewhat different from COVID, is that water itself is a final status issue in the Israeli-Palestinian conflict. And if we can, and at EcoPeace we argue that water is the low-hanging fruit, that resolving water issues, much due to Israeli leadership in water technology, is the most solvable of all of the final status issues. It's only if the cooperation on the environment can lead to a fair share in the allocation of the natural water resources, will we see the real spillover effects leading to conflict resolution and potentially building trust to deal with the other final status issues, including Jerusalem. So there must be this spillover. And I think that very much builds on the very initial comments of Iran, that conflict resolution doesn't happen by accident. It must be led by design, and it must be led through a vision. We have an opportunity where we have seen, whether it's a honeymoon, whether it's a dating program that started in East Jerusalem and West Jerusalem because of COVID, it won't lead us anywhere unless there are actors that build on those steps taken and take it further forward, as I think EcoPeace is trying to do by design on the environment issues, to lead to an actual conclusion of a final fair agreement as to how we share water fairly between Israelis and Palestinians, and how we manage our broader sort of water environmental issues in the region between Israelis, Palestinians, and Jordanians.
Thank you very much, Gidon. At this point, I'd like to bring back in Eran into the discussion. Eran, just to recap, for those of you who've just come on or perhaps forgotten that he spoke an hour ago, gave us a very fascinating discussion about the role of interdependence, the idea of uncertainty giving us some perspective, and the idea that the common threat that Corona posed has some role to play in conflict resolution processes. Eran, you specifically spoke about what you described as expanding the borders of empathy. I wouldn't mind drawing you in on a particular issue that no one's touched on yet, but I think was very significant in the Corona response in Israel, and that was the Arab-Israeli medical staff. So for many Israelis, certainly on the news, and obviously those of us unlucky to have been in the hospitals during that time, the hospitals in Israel were the coalface of COVID-19. And Israeli hospitals have a very high percentage of Israeli Palestinian workers, something like 30 to 40% are staffed by Palestinians. And so this is where, in fact, we're seeing suddenly Israelis being treated by Palestinians, Palestinians being treated by Israelis, a different kind of interface with this common threat. I mean, in some ways, when you talk about expanding the borders of empathy, do you think that a medical emergency on that particular front was able to humanize the other in a different way? What could you say a little bit about that particular aspect of COVID?
Well, it's a good question. With your permission, I'd like to refer to very briefly to one or two other things, and then I'll get to this point. Okay. First of all, it was said at some point that I said that people should, under threat, stick to their own group, etc. I just want to correct it. What I said is that this is part of their psychological needs. We don't want them to behave this way, but this is what most people do when they feel under threat. Taking risks, being creative, being cooperative under threat is going against our intuitions and psychological needs, and that's one point that should be said. Second point, again, very briefly, is that for me, and I think that it speaks very nicely to some of the things that were said here before, the main question is, what would we take as the main messages from this crisis? And there were very positive things that happened and some very challenging things that happened. The main question is, how can we frame the positive things that happened as something that we can take with us to the future? For example, cooperation is possible. Here, I mean, we know that it's possible because it happened. For example, interdependency is something that maybe we will also face when we will have to deal with other issues in the future. And these are messages that are driven by the specific situation, but are more generalizable to other situations as well. Now I'll go back to your question, and I'll connect it also to what Mir said before and others. And I think that that's a very important point. There's a great paper in social psychology. It is called The Irony of Harmony. It was written by an Israeli professor, Tamar Sagi, together with some American scholars. And it basically says that, what we usually thought of as a sequential process, first, we create harmony and cooperation between people from different groups in conflict. And then through this harmony and cooperation, these people work together towards a political and social change. This is what we had in mind for many, many, many years. In 2011, they published this paper, and since then, it's been replicated for so many times. And it's basically saying, this is not the way human being works. So it doesn't work this way, that first we create cooperation and harmony, and then it leads to social and political change. Sometimes it stops with the cooperation and harmony. And sometimes, at least from the perspective of the high power group, in this case, the Jewish-Israeli side, when we give cooperation and harmony, we feel uncommitted anymore to create social change, social and political change. And I think that it speaks very nicely to what Nir said in his words at the end. And it also speaks to what you said before about the doctors and the Arab doctors and nurses in Israeli hospitals. Israelis, Jewish Israelis, feel very, very good about, cooperating and humanizing Arabs when they are part of this, hospitals and health teams. But I'm not sure that they make this move or transition also to the questions of, social justice, equality, and political change. And this transition that seems to many of us is almost natural is not so natural. And sometimes even, feeling more, cooperation and empathy towards the outgroup prevent us from moving forward towards social change. The explanation of why does it happen is a little bit more complicated, but you'll have to trust me that that we have enough evidence to support this argument.
You have my full confidence and trust in that. And I, on that note, want to direct the conversation back to Naveen. We have a question in relation to the sense of self-empowerment that Palestinians may have had in a different way in East Jerusalem than before during COVID. In a sense, the questioner was wanting to ask whether this was an example of Palestinians being able to take their sort of destiny into their own hands, and particularly around your discussion on the coalition group. Is there any further permission that's been granted or any development you could speak to on that? So if you could just speak to empowerment of Palestinians in East Jerusalem with Corona, and even if it's too little too late, I'm going to anticipate your answer. Even if it's too little too late, what's the best practice? What could Jews see practically? Naveen, please.
Okay, I'm not muted now. Okay. So I don't know, it's just the too many Zooms that are going on. That's a good question. Thanks for asking it. So basically, it's the people in Jerusalem, because of the lack of representation and the disconnect from both the Israeli side, but also from the Palestinian side, they have filled in this gap by creating that kind of community unity, which is very important to understand. Whenever there is a crisis in Jerusalem in general, the Palestinians in East Jerusalem, they come together and they form a unity and they work together. It is not a coalition to say that needs permits to work or have some sort of special authorization or a special registration. We have seen them also come together, for example, when we had the crisis with the cancer patients in one of the hospitals that didn't have enough funding for cancer patients who came from Gaza. So the Palestinians in East Jerusalem, they started demonstrating for those Gazan patients to get more money, but they also were able to collect 2 million shekels in one day for those patients from Gaza to be able to get treated for cancer in East Jerusalem. We have also seen them during the Corona when they come together. Now, will they be permitted to work or not? It's a good question because normalization, the notion of normalization is still there. With the annexation going on right now, it makes the cooperation even more difficult and even more, let us say, threatening to those who want to work with the other side. Because I've been listening to more also from people from the West Bank as well, that if you're working in the civil society thing, you are trying to build bridges, you are a traitor, you're a normalizer, especially now as your leadership, the Palestinian Authority, is cutting ties with Israel. Will it be working again whenever as the crisis right now is coming back? I think they are going to be working again, and I think they're going to be learning from the mistakes that they have done. We need to remember that they worked under the umbrella of the World Health, the WHO, World Health Organization. They worked in cooperation with them, which they're going to do once more. For me, sometimes I feel it's an issue of not only politics, but sometimes ego. That you don't want to talk with the Israeli municipality. Why doesn't the municipality just grant us as a gesture of, as a good gesture, you know, as, okay, we're gonna grant you these permits, but it's just like sometimes, no, we're not, because they didn't ask, and no, we're not gonna ask because they didn't give us the permits. So it's kind of in that.
Nada, can I jump in here? Because I think you've just touched on two really important points that I wouldn't mind teasing out with you, particularly because we don't have Nada, who's the Palestinian director from the West Bank. So when you're talking about the discourse and challenge of normalization, you've touched on two things which I think are interesting. Well, I guess the first is the idea of ego. And so it seems to me that for you to be so successful in your work as an East Jerusalem activist, you've had to, in some ways, put a lot of your ego aside and perhaps, eat a lot of humble pie and a lot of humility and also a lot of courage. My question is, for those of us involved in peace building and transitional justice, in the Israeli-Palestinian sector, what is your response to the normalization obstacle? So how do you justify your work as a Palestinian woman in East Jerusalem? What would you say when you are told that you're a normalizer? How do you defend that? How do you defend your work? How do you defend putting
Sure. Good question. So basically, what is normalization? If normalization means that I am using a rights-based approach, is my connection? Okay, I'm back. So the first thing is actually using this thing is, what is normalization? Normalization should be basically means that you are normalizing the occupation in a sense. The checkpoints are there, the separation wall is there, a lack of accessibility is always there. For me, those things shouldn't be normal, but they are becoming normal. For me personally, this is normalization. But when I talk to other stakeholders, whether they are Israelis or international community, and I use the approach of talking about rights and talking as an equal to the other one, that this is my right, then that is not normalization anymore. When you are a resident in East Jerusalem and you pay your taxes, why aren't you getting your rights? Forget the politics. Politics, they have their own representatives. I'm not a politician. I pay my taxes. I need to have rights as well. I need to have representation as well. I need to have my voice heard as well. And for me, this is not normalization. This is doing exactly the opposite. It is putting all the issues on the table and saying, okay, you need to deal with it. You have this problem. Don't close your eyes. Deal with it now. So that's at least the way that I personally and others look at it in that sense. Can I just say a very quick point for Nir? Because Nir, I think you mentioned about the mayor of Jerusalem. And I just want to say, don't forget that also the mayor has a very strong opposition inside the municipality council, which are more lefties, and they're putting a lot of pressure on him as well, more or less, like, what are you doing in East Jerusalem? They are giving and putting all these questions. And I think it's kind of now the East Jerusalemites are being used in some sort of a political game for gains at the municipality level. I'm not sure it's coming from with good intentions.
A strong left-wing opposition in Jerusalem? I don't familiar with.
No, I'm talking about.
You have inside the coalition two members who are left-wing,
yeah,
and Tori Root, which is the opposition. Well, I think half of them are Likud party members. I'm not sure how left the other.
But Root and the other two members, I think they are putting some sort of pressure on the mayor.
Yes,
I mean, as far as I hear from them.
Right.
So.
and I think it's very important to understand the differences between the municipality and the police, for example. the police didn't had any change of the mind of the head of the police in Jerusalem concerning East Jerusalem. I'm just remind you that they shut down a clinic in Silwan because they says they have some connection with the PA. They confiscated a food truck in Surbaher, and you spoke before about the act in Kufr Akim. So yeah, I think we have to notice the differences between the different authorities, Israeli authorities concerning East Jerusalem.
I want to add, Jeremy, if I may, it appears as if those acting in the peace movement and conflict resolution on the Israeli civil society side have an easy time. We don't have an easy time at all. There's lots of accusations, not only on Palestinian activists, but very, very much also on Israeli activists as being traitors, that if you're working with the other side, you must be working for the other side. And of course, that couldn't be further from the truth. And I think that, again, coming to some of the comments of Iran, your narrative here is essential. And building up on the experience of COVID, or the drawing from the lessons of COVID, there's a real importance to reinforce the narrative of interdependence. That is not out of generosity, not out of kindness, not out of identifying that we have no choice but to work together. And I think that, as Nada said, the way that our Palestinian staff in particular, or anyone that's active with EcoPeace on our work on the Palestinian side, speaks to obtaining Palestinian water rights as the narrative that helps not only protect them, but really express what they're trying to do. And on the Israeli side, we very much speak about water security, that Israel can only obtain its long-term water security needs if it's cooperating with Palestinians and Jordanians, because our water issues are so interrelated, interdependent. So generosity and kindness actually don't get us very far at all. They fade out very quickly the moment there's some violent act that takes place. But common interests, and building narratives that speak to interdependence out of necessity, they're long lasting, and they can really, from our experience, they can be the engines that help advance conflict resolution, trust building, and hopefully into the future, peace in our very troubled region.
Thank you, Gidon. Well, let's hope that COVID-19 is not long lasting, but what it is, unfortunately, is enduring. And so this brings me to, I've got two final questions. This one is to all the panelists, and then the last one is just to Iran, specifically in relation to his research that is COVID-19 specific. But just as a general question to all the panelists, and if you could sort of be very brief in your response, we have two, in some ways, game changers at the moment since the honeymoon, or whatever we want to call it, from the first wave. And that is, we have a second wave now of COVID-19 in our region, and that has come almost simultaneously with annexation on the table. So when, in some ways, not going to be too original, everyone's talking about annexation, we would also want the opportunity. How much has annexation diminished earlier gains made by Corona? Is annexation a complete smokescreen, or is it just more of the same in a way, and COVID-19 and some of the cooperation necessity is still very relevant because of the second wave? And also there's some confusion also with the second wave. Has that any impact on Israeli-Palestinian cooperation? So if I could just have a few comments from each panelist specifically on the annexation and the second wave of Corona and the confusion, and then I'm going to specifically bring in Nir on his research. Gidon, should we go back to you and then we'll go to Nir?
Sure. So unilateralism, annexation is an expression of unilateralism, and unilateralism destroys, undermines all opportunities to advance cooperation. So certainly at EcoPeace, we've been extremely vocal against annexation because of the unilateral measure taking place here, which pulls the rug from under our feet from all efforts that try to advance common interests and understanding of the importance of interdependencies. And our fear is indeed that if any level of annexation, I mean, thank goodness we're seeing that Jordan Valley annexation is increasingly being removed from the table, but any level of annexation will take us back. It could be for several months, it could be for several years, until a new impetus can help us overcome the damage that a unilateral action takes. A broader annexation, in our opinion, could be devastating to the whole concept of the two-state solution.
Okay. Nir, do you have any comments on annexation specifically?
I can just say that if you look on East Jerusalem, if we have one thing to learn from East Jerusalem is that annexation doesn't solve anything. It's actually doing the situation worse. East Jerusalem was annexed 53 years ago, and the situation today is not better than in the West Bank, I think. I don't see the annexation as a real thing that's going to change in anything in the short period. Except of rising the volume of violence. This is, I think, the only effect that the annexation will have in the next few months.
Sorry. Yes. Sorry.
Do you hear me now?
Yes.
Okay.
So violence is, sorry, just to sum up, violence in the short term may be...
this is the only effect that the annexation will have.
Okay.
In the short term. This is what I
Naveen, do you have anything to add on the annexation game changer? Do you think it's going to have any impact whatsoever in the short term, to the extent that peace building or some East Jerusalem activism has left some mark in the COVID-19 follow-up?
Well, first of all, annexation is for us, this is the dialogue that's been ongoing right now, is that there has been always facts on the ground in the areas that are going to be annexed, whether it is more land confiscation or whether it is more house demolitions and infrastructure demolition or settlement expansion. So it's the facts on the ground has always been there. So more or less, annexation is just, as I would like to use the term, coming out of the closet and calling things as they are. So that's one thing. For us in East Jerusalem, I don't think we're talking about it as much as we're talking about COVID-19, because as Nir rightly pointed out, we have been annexed since '67, and we know what annexation means and we know what to expect, and it is not the best thing for Israel actually to do. I will also agree with Nir. I think that we're going to see some violence, especially with the Gazan borders. Hamas and the Islamic Jihad are going to step up and say, this is the call for liberation. And I hope we don't see something in the scale of 2014. And in a sense, we're also now seeing more and more demonstrations happening inside the West Bank that are led by Fatah specifically. But in general, the Palestinian population have more issues to care for, especially the economic factors. They don't have salaries right now. So this is what their main concern, and also COVID is their main concern. much more than the annexation, because as I mentioned earlier, it's been ongoing for a while.
Okay. And so just mindful of time, I'm going to give Iran the last word. And Iran, you're welcome to say, to share your views specifically on the annexation question, but I might also give you a couple of minutes, literally 1 or 2 minutes, to share any initial results from your COVID-related research. If you have any additional findings, this would be a great time to share it, and then we'll wrap up. So Iran, you have the final word.
Wow, a lot of responsibility on my shoulders right now. I'll say very briefly, first about the annexation. I think that we are in a very, very interesting situation. I'm referring mainly to the Israeli society. First of all, our data shows, and we published a large-scale survey today, this morning, that there's a huge majority in the Israeli society opposing the annexation. Like 70%, 69% of the Israeli society opposes the annexation. I think that given that it is, it is approaching us in the context of the COVID-19 crisis, even further highlights the huge gap between what the public really cares about and what the government is dealing with, which creates even more opposition to annexation, which is again, a very interesting situation. I will also say, and this might be not a popular thing to say here, that there's also a huge opportunity in this situation, because the annexation brings back the Israeli-Palestinian conflict to the public discourse in Israel. Something that wasn't considered as part of the discourse. Suddenly we can put on the table, different options, different alternatives. Let's let the Israeli public decide what would be the more, the preferred option. And we see in the data that the Israeli public, again, when it comes back to the public, knows exactly what they want to do. And it's a very, very interesting opportunity. So I don't see it only as a challenge, but also as an opportunity. In 2 sentences about our studies, empirical studies on COVID-19, and I think that it speaks very nicely to what I said at the beginning of my talk. One interesting thing that we see is that people were more affected, mainly, I'm referring mainly to Jewish Israelis, the more they were affected by, personally affected by the crisis, both in terms of health and in terms of financial situation, the more positive their attitudes towards the Palestinian society became. And this is very, very interesting. And it also contradicts what happened when it comes to their views towards ultra-Orthodox and Palestinians who are living inside Israel. So in many, many ways, what we see is that levels of threat and anxiety led to an increase in their negative views of Jewish Israelis towards the inner or internal groups within the Israeli society, both Palestinians and ultra-Orthodox, but to an improvement in their views towards Palestinians. And I think that it was driven by the thing that we mentioned before, a sense of cooperation, common enemy, expanded empathy, and we definitely see it in the data that we have.
Thank you very much, Iran. So I think that we can draw to a close, and I personally, on behalf of the Minerva Center for Human Rights and Hebrew University's law faculty, thank all the panelists for a sort of a very vigorous, brave, and optimistic discussion. In some ways, the kind of work that we're engaged in is very challenging and complex. And sometimes when we talk about opportunities, it's sort of like looking for the little tea light candle in an otherwise very dark cave. So whether we described COVID as a honeymoon or whether it was just a first date, it does seem to have had some kind of paradigm effect or shift, notwithstanding talks of annexation or otherwise. And on that note, I'm very grateful for the exchange. Thank you all participants for joining us. The talk will be recorded. So those of you who wish to watch it again or share it with your friends and family, please do so. Tomer, do you have any concluding remarks?
No, thanks. I think you've really wrapped up. It was just a wonderful discussion, and it's already should be already available on Facebook, and we've had lots of other viewers there as well. And thank you again, everyone, and thank you, Jeremie, for the organization.
Thank you, Gidon, Nir, Iran, Niveen. Wholehearted thanks to all of you. Thank you everyone for joining, and we look forward to seeing you on another event hosted by Minerva, if not this year, the next year. Thanks again.
Thank
Bye-bye.
you. Thank you so much. Thank you. Bye-bye.
Shalom.